This is Sean, and this is Troy. Both are plastic surgeons running a joint practice, but they have very different standards of beauty. Sean is the calm one, focused on his home and family. Troy, on the other hand, lives for the moment, not caring about anyone, obsessed only with looks, money, and women. Every day brings a different case, always starting with the same question. Tell me what you don't like about yourself. We see the first patient visiting Troy. When he asks the usual question, Peacock replies, pretty much everything. Suddenly, Grace interrupts, introducing herself as the new psychologist. Troy invites her to join them because he senses this patient needs psychological help more than a knife to convince her she's beautiful without unnecessary surgeries. He asks Peacock about the specific surgeries she wants. She lists full-body liposuction, a nose job, and removal of stretch marks. As she speaks, he writes down every detail. She explains she traveled far and saved up a lot of money because her graduation is next month. She wants to look special and stop the bullying she's endured for years. She explains that she has had a hard time due to her weight and her classmates' mockery, until she finally decided to get surgery to escape their judgment. Troy promises she will be the most beautiful girl at the party and accepts her case, leaving her overjoyed. On the other hand, Sean is summoned to examine a case at a private home, something unusual for him as patients usually come to the clinic. Upon arrival, he finds a crowd, police, city officials, and paramedics gathered in front of the house. There are strict warnings that no one can enter without disinfectant and a mask. Inside, the house is a mess with an unbearable smell. Suddenly, he sees the patient. She suffers from morbid obesity, weighing over 500 pounds. She hasn't moved from her couch in years, to the point where she has become part of it, and her skin has actually fused with the fabric. Sean asks the lead medic why they haven't moved her to a hospital. He explains that every time they try, she screams in agony, which is why they called him. He introduces Sean to the patient, Mama. Sean gets closer and asks about her health. She says she is fine, but her husband, Denny, panicked and called the ambulance when he saw her breathing with difficulty. She assures him she doesn't need medical help. Noticing the construction workers staring at her, she feels humiliated and asks Sean not to let them look at her that way. He orders them outside. He asks how long she hasn't moved from the couch. 3 years, she says. Sean is shocked. She explains she suffers from severe sciatica pain that shoots from her back to her leg. Walking even one step was agonizing, but sitting relieved the pain, so she just never got up. She tells him the TV keeps her company 24/7 and that her husband hasn't neglected her, bringing her whatever food she craves during his weekly visits. When Sean asks how she uses the bathroom, her expression changes and she refuses to answer, though the smell makes it obvious. He warns her that he needs to examine her skin and it might hurt a little. As he expected, her skin has fused to the couch fabric. It is impossible to separate them without medical intervention. They will have to surgically remove layers of her skin. Trying to hide his shock, Sean excuses himself to speak to the lead medic. He insists they must move her to the hospital immediately. She has been sitting in her own waste for 3 years, and bacteria has spread everywhere. Her skin tissue is necrotic and fused to the sofa. The medic replies coldly that she hasn't moved in 3 years, so another hour won't matter. But Sean warns him she is essentially rotting, and a blood clot from her legs could travel to her lungs and kill her at any instant. He explains he just needs to move her legs, but since she can't stand, she must go to the hospital now. The medic asks how, given she can't fit through the door, let alone with the couch attached. Sean looks around and gets an idea. Break down the wall to get her out. Everyone is shocked by the suggestion. The construction crew starts demolishing the wall. Mama begs Sean not to take her out in front of the crowd like a spectacle, fearing their mockery. Sean orders the workers to get a tarp to shield her from the public. More than 30 men lift her and the couch together, placing them onto a crane. She calls out to Sean, asking for her husband because his presence reassures her. Sean asks, "May I take his place?" He promises to ride with her and holds her hand to comfort her. News reaches Troy and he arrives at the hospital with their assistant, Liz. Sean shows him the case personally, telling him to scrub in immediately. Troy looks at Mama, having never seen a case of obesity this severe. Sean, now in scrubs, assures Mama he will give her local anesthesia so she won't feel a thing. We learn they have to operate while she is awake because in her condition, general anesthesia would be fatal. Sean promises she will get through this and be better than before. She tells him she trusts him but admits she hates needles. We see over 100 syringes lined up. Troy suits up and joins the team. They begin injecting her legs, one needle after another. With about 20 shots left, Liz pulls them aside, warning that Mama can't handle any more pain. Suddenly, Mama might suffer a heart attack. Liz points out that even the amount of anesthesia they have given her so far poses a significant risk to her life. Sean agrees with them that they will perform the surgery in stages, working on one area at a time. At the same time, her husband, Denny, arrives. Sean goes out to speak with him, introducing himself as the doctor who will perform his wife's surgery. Denny asks to go in and see Mama before they start. But that is impossible now that the room is sterilized and she has been injected with all that anesthesia. Sean tries to explain calmly that any infection could cost her life, assuring him he can check on her after the surgery. However, Denny gets agitated and insists on seeing her, claiming it is his right as her husband. Sean loses his temper, snapping back, "And were your rights to leave her on the couch all this time? Sending her enough food for a week and a TV so she wouldn't get up?" He implies that if Denny truly loved her, he would have sought help much sooner, before her condition deteriorated to this extent. He threatens to sue Denny for negligence. Denny insists he loves her, wanted her to lose weight, and tried to help her many times. They begin preparing her for surgery as the local anesthesia takes effect. Sean and Troy take a deep breath, each grabbing a scalpel. They start working on one leg, attempting to remove the damaged layers of skin. They discover a stage 4 infection that has reached the bone. Mama gets scared and asks, "What does that mean? Are you going to cut off my leg?" Troy is honest with her, saying if they can't treat it, unfortunately, that is what will happen. Sadly, she asks how she will ever get off the couch if they cut off both her legs. Sean distracts her, telling her that her husband is waiting outside and offering to call him in to hold her hand and comfort her. She refuses, saying she doesn't want him to see her like this. Troy takes off his medical glove and offers her his hand to hold, letting Sean continue the surgery alone. He compliments her manicure. She tells him it is the only thing she could do for herself, mentioning that her daughter always told her she was very good at it. They are surprised to hear she has a daughter and ask about her. Mama explains her daughter used to visit every week, but hasn't visited for a year because the last time she came, she said she couldn't bear seeing her mother like this anymore. She explains that she always loved cleanliness and keeping her house tidy, but day by day, her legs felt heavier until she couldn't move anymore. Liz enters. They had sent her with a skin sample to the lab for analysis. When they ask her what stage the infection has reached, she stays silent and doesn't answer in front of Mama. Understanding the silence, they try to keep their expressions neutral so as not to upset the patient. They step aside to talk. Sean warns them she has lost a lot of blood, her blood pressure is dropping, and she won't survive them working on the other leg. Troy adds that separating her from the couch will take days and weeks, so they need a solution. At that moment, Mama looks around, seeing bloody towels everywhere. She feels this is the end and that she won't make it through the surgery. Suddenly, the heart monitor beeps rapidly. She suffers a sudden heart attack. They rush to resuscitate her and prepare the equipment, but Liz turns off the machine. She informs them that Mama signed a do not resuscitate (DNR) order before entering surgery. Her vitals flatline. Mama passes away and they are all saddened that she fell victim to morbid obesity. They cover her funeral expenses. Her daughter attends and tells them, "I know you're judging me," wondering what kind of daughter leaves her mother in this state and doesn't check on her. She explains that Mama was the one who asked her to stop visiting because she didn't want to be seen in that condition. Denny arrives and thanks them for everything they did for his wife, mentioning they bought 2 burial plots and a large metal casket to bury her, expenses he had been worrying about since he heard the news. After he leaves, Troy tells Sean that this case has reignited his enthusiasm for work and that he is ready to see the rest of his patients after taking 2 days off. He says, "Let's go. We have a lot of work at the clinic." The next day, a Michael Jackson impersonator comes to see Troy. He has undergone multiple facial surgeries to look like his favorite singer. He is a star in his own right with fans, making good money from his resemblance to Michael Jackson. He comes to Troy for a third nose job to correct a deviation, having been recommended by many who called Troy the best plastic surgeon in town who could easily fix his problem. Troy listens, writes notes, and diagnoses him in his report as a patient living in delusion. He tells him frankly, "My advice to you as a doctor is to stop having unnecessary cosmetic surgeries." He asks, "What's more important, looking like your favorite star or being able to breathe?" Tactfully implying his refusal to take the case, he asks his assistant to show him to the door. We switch to Sean sitting with his family, solving a new problem for his son, Matt, who recklessly injured himself by mistake. Sean promises to supervise the surgery himself and fix everything, but the family drama doesn't end there. A police officer knocks on their door, asking to speak with his wife, Julia. The officer accuses her of causing a car accident that resulted in the death of an animal. He informs her it is just a misdemeanor requiring a $5,000 fine. Just as Sean is about to defend her, claiming she couldn't even kill an insect, she stops him and confesses she actually did it. The next day, Sean meets Troy and complains. His son tried to self-circumcise and his wife killed an animal. "I'm living in an asylum, not a home," he exclaims. He finds Troy unresponsive. When asked what's wrong, Troy scolds him for firing the male psychologist without his permission and hiring a female replacement without even telling him. Sean tries to justify it, but Troy accuses him of firing the guy out of jealousy, fearing he would steal the spotlight. Sean retorts that he did it because 75% of their patients are women, and he believes they would feel more comfortable talking to another woman. He insists he is doing his part to keep them #1 in the market so patients don't flee to other hospitals. Troy says he will believe him this time, but adds, "Be honest with yourself, Sean. You hired Grace because you like her and have your eye on her." Later, they enter the operating room together to prepare for Matt's surgery. Troy refuses to let Sean operate on his son alone and scrubs in to help. Sean reassures his son that it is a simple procedure they have done many times, promising he will be fine. The nursing team counts him down from 1 to 10 until he loses consciousness. Noticing Sean's hands are shaking with nerves, Troy says, "Step aside, I'll do this surgery for you. You go do the tummy tuck for my patient." Sean agrees, and they swap. Sean goes to operate on the patient, Grayman, opening her abdomen to remove excess fat and skin, then stapling and closing the incision. By late afternoon, Grace comes to Troy with the test results for his patient, Peacock. She informs him she tested positive for psychiatric medication. She argues there is no need to perform such a dangerous surgery on someone with depression when medication isn't working, explaining the problem is psychological and that, ethically, they must refuse her. But Troy ignores her concerns. Just then, Sean arrives, hears Grace out, and sides with her, agreeing they should reject the case. Troy gets furious and pulls Sean aside to talk privately. He snaps, "Just because you like her doesn't mean you agree with everything she says and take her side against me and my patient." Sean retorts, explaining they hired a psychologist specifically to take her advice on cases like this. He points out that the patient is on psychiatric medication and has lithium in her system, meaning complications during surgery could easily kill her, a risk they don't need to take. He suggests she might be going through a manic episode and isn't in her right mind. Troy argues that a surgery like this could change her life, curing her and improving her condition more than 1,000,000 pills ever could. Sean objects, insisting, "We don't just accept any patient who knocks on our door." Troy fights back, asking, "Are you implying I have no ethics and exploit my patient's conditions?" Sean replies bluntly, "Yes, exactly. All you care about is money." Troy defends himself, reminding Sean that he literally just rejected the Michael Jackson impersonator that very morning, proving that statement wrong. But Sean ignores him, lecturing him on the risks of the surgery. Troy cuts him off, saying if they talked about risks, they'd never finish because no surgery they do is 100% guaranteed. Sean tries to calm him down, stating they simply cannot perform a risky surgery right now. He concludes, "Bottom line, we aren't accepting this case." He gives Troy a choice. Either Troy calls her to break the news, or Sean will do it himself. Meanwhile, we see Peacock pushing herself hard at the gym, trying to lose some weight before the surgery. She receives a call from Troy, who apologizes, saying they can't perform her surgery next week. She replies that they can't delay it for too long because the party is next month, and she needs time to recover. Troy drops the bombshell. He isn't calling to reschedule, he is calling to cancel it entirely. She pleads, saying she knows she is overweight and mentions the nurse told her she needed to lose 10 kilos before the operation, promising she is doing everything she can. Troy clarifies they aren't canceling because of her weight, but because ethically they cannot proceed, suspecting she is going through a severe psychological state. He explains every hospital has its standards and recommends another doctor who might help. Peacock gets angry, yelling, "I don't have time to start over with consultations and tests. If you want more money, say so and I'll give you whatever you want." Troy tries to explain calmly that it has nothing to do with money, but she furiously ends the call. The next night, Troy goes to the garage to find his car completely trashed. When he takes it to the mechanic the next morning, the mechanic hints that someone clearly holds a grudge. Troy is certain it was Peacock retaliating for the rejection. Later, Sean calls him, asking why he is late and reminding him they have a surgery soon. Troy explains he has a small problem with his car. Then Sean asks why Troy scheduled a neck liposuction for Grayman when they just operated on her recently. Surprised, Troy denies scheduling anything, saying he just performed the same surgery on her a year ago. So something must be wrong. Troy calls Grayman. She answers, reassuring him she is fine and healing well, adding it was a sweet gesture for him to call and check on her personally. He asks who put her name on his surgery schedule. She admits frankly that she bribed the nurses to add her. He tells her he doesn't approve of this surgery. She ignores his refusal, explaining she has a charity gala next month attended by VIPs and she needs to look her absolute best. He snaps at her, telling her never to act without consulting him again. She replies that she doesn't like his tone and warns him to think before speaking to her that way, insisting she will arrive on time for the surgery. He explains he can't operate on her since it hasn't even been a month since her last procedure, citing professional ethics. She mocks him, laughing, "Are you pulling that on me? Since when do you have ethics?" implying their relationship goes beyond doctor-patient. Finally, Troy ends the conversation, telling her to find another doctor because from now on, he won't perform any more surgeries on her. A few days later, Grayman arrives with her lawyer, accusing Sean of leaving a metal instrument inside her stomach, which security discovered when she set off the metal detector. They show him the x-ray, explaining they went to her personal doctor who removed it immediately. Sean apologizes to her, but she retorts that the one who should apologize is Troy. Troy asks what compensation she wants. She demands $10 million. Later, Sean furiously blames his assistant, Liz, saying she should have been more careful. She defends herself, reminding him that as the surgeon, Surgical Basics 101 dictates he must ensure nothing is left inside the patient before closing up. That's the rule. She hints that his son's surgery was occupying his mind, implying that if anyone was negligent, it was him, not her. Sean apologizes for snapping at her, but she rejects his apology, hands in her resignation, and walks out. Troy gloats, mocking him. The great, mighty Sean, who lectures me constantly about responsibility, makes a mistake a first-year med student wouldn't make. He points out they are in real trouble this time. Sean is terrified Grayman will leak the story to the press, destroying their future and the public's trust in them. Sean hints there is only one solution. He suggests Troy go and smooth things over with her, insisting she has a crush on him and he can convince her. He blames Troy, saying if he hadn't rejected her case, she wouldn't have done all this. Troy counters, "I did that for you." Sean replies, "I didn't ask you to." Troy reminds him that Sean constantly lectures him about ethics, so he shouldn't blame him for refusing to operate on a patient who just had surgery. He insists Sean is the cause of this mess, just as he caused Peacock to wreck Troy's car. They bicker like roosters, blaming each other. In the end, Sean makes a deal. He will handle the Grayman situation if Troy agrees to follow up on Peacock with Grace. Later, Grace goes to Peacock's house. She sees photos of models and celebrities pinned up everywhere. Realizing Peacock is obsessed with beauty standards, wanting to look like them so people will love her. Peacock appears and asks why she is there. Grace explains the doctors wanted to check on her. Peacock replies bitterly, "Here I am, as you can see, doing laundry and making dinner. And as for my graduation party, I won't be going because of you. Hope you're happy." Grace tells her she noticed she stopped her medication, as it showed in her blood test. She asks if her psychiatrist is aware of this. Peacock admits she stopped seeing him and hasn't taken her meds for over a month because they weren't helping. She placed all her hope on the surgery, adding, "And now you all failed me and refused to help." She confesses she has a crush on her coworker Jim. She wanted a new look to attract his attention. Changing her tone, she says, "You know, if he saw you, he'd like you. Guys like Jim go for girls with perfect bodies, no flaws, not someone who has to wear a corset under her clothes." She adds that she hates girls like Grace because they attract men effortlessly. Grace notices Peacock becoming agitated and gets scared, especially seeing a sharp tool in her hand as she steps closer. Trying to diffuse the tension, Grace asks about Jim. Peacock points to the pictures on the wall, explaining she wanted to look like them so he would notice or even talk to her. Realizing now that Dream is dead because of the doctors, Grace asks, "Is that why you wanted revenge on Dr. Troy and wrecked his car?" She suggests Peacock shouldn't take a doctor's rejection personally. Peacock snaps, shouting, "Destroying my dream was personal. Denying me the chance to change and become a new person was personal." She explains she is tired of being bullied and ostracized for her weight. She tells Grace her visit is over and asks her to leave and never come back. Meanwhile, Troy goes to Grayman's house to apologize. She tells him his apology is worthless. He asks why she is doing this, knowing she doesn't need money since her late husband left her a countless fortune. She replies she is doing it because he abandoned her. "You always think you made me with your surgeries," she says. "But the truth is, I made you. Without me, my money, and the friends I sent to your clinic, you are nothing." She rubs it in his face, reminding him that her parties and invitations made him famous. "And after all that," she adds, "instead of thanking me, you abandoned me." Troy approaches her, explaining she is his masterpiece. He says he saw no need for further adjustments because to him, she had become perfect. He realized his work was done. He apologizes for expressing it poorly at the time. But Grayman doesn't buy it. She points out that her dream was to hear those words when they were genuine. She tells him to think about her offer if he wants to save their clinic. Later, Troy recounts the conversation to Sean. Sean confirms, "So she implied that if you do the surgery, she won't sue?" Troy snaps, "Forget it, Sean. I'm not getting near that old woman to fix your mistake." He admits Sean was right about Peacock wrecking his car and advises him to call the police. Sean replies they can't involve the police now. He warns Troy this isn't the time to be reckless, asking, "Have you forgotten? Those were your words." Stuck in a dilemma, Troy points out that if they don't pay her the compensation, she will shut down the clinic. "I'm sorry to say this," Troy admits, "but I'm not ready to wake up in my 40s working at a candy store call center after my career in plastic surgery." Sean suggests negotiating with her lawyer and paying the settlement from their joint savings. Realizing the solution will hit his wallet hard, Troy rushes back to Grayman, charming her to fix the situation. Meanwhile, Sean leaves a voicemail for Peacock. He acknowledges she visited the clinic last week to consult his partner and asks her to come in today so he can meet her too, leaving a specific time. We see her listening as she gets ready. Back at the clinic, Troy arrives to find Grayman scheduling her surgery. When he clarifies he still hasn't agreed to do it, she tells him she will have it done. Not only that, but from now on, any procedure she wants will be free of charge. Not a single US dollar paid. After she leaves, Troy breaks the great news to Sean. Thanks to Sean's mistake, their wealthiest patient will never pay them a dime again. Sean informs him that Peacock has arrived and he will go see her alone. He enters the room. Without preamble, she tells him she is ready for surgery tomorrow and even brought makeup to cover any bruising. Sean notices her hands shaking, realizing it is a withdrawal symptom from stopping her psychiatric meds. He shocks her by saying he didn't ask her here to schedule surgery, but to truly help her. "You can help me by changing my face and body. she says. Sean explains she can't just stop her medication, warning that it could lead to an uncontrollable episode. He recommends a psychiatrist he knows who can treat her condition. She isn't convinced, insisting she isn't crazy. He explains she won't have to pay anything and offers to take her there himself. Trying to stay calm, she opens her bag, takes out a pen, and asks for the doctor's number. Sean is relieved, thinking he got through to her. At the end of the day, Sean returns home and checks on his son. Matt thanks him for helping him, along with Dr. Troy, saying, "I'm lucky to be in the hands of the best plastic surgeons." Sean is touched. On the other side, we see Peacock sitting in front of her wall of beauty queens and models, feeling inferior because of her weight. In a severe depressive episode, she gives up. Suddenly, she puts a gun in her mouth and ends her life, having lost hope of ever looking like them. The truth is, it wasn't the doctor's refusal that drove her to this. The real cause was the people who bullied her and planted the idea that looks are everything. We understand that bullying and obesity claim many victims, often posing a danger far greater than surgery itself.